Ashley, Medicaid Maverick. So let me tell you an actual successful story of a free clinic and how it was very useful. Um, I'll give to maybe one of a pediatric because I'm not saying I'm over the whole, like, let's save the kids. I mean, I'm all about saving kids. I really am. I'm all about saving adults and old people. So I was at the emergency room. Mom came in. She had a pending Medicaid case. Now, as you know, if you have no insurance, you call up. You have a secretary answer the phone. He or she will go, well, no insurance. Sorry, can't show up unless you got $75 to $150. Doesn't matter the situation. So anyway, Mom showed up with the kid. Kid had gotten mauled by an animal. Got to be careful what we say here. But this is years and years ago. So even if they heard the story, they probably wouldn't remember it. Or they might remember me going, here goes the number, the address of the free clinic. It closes at 7:30 or 8. I forgot the time of the close. In a particular area of Florida. Gotta love it. There's several there. And I said, get there so you can get your meds because Mom had no money. She came to the emergency room. I helped assisted with the Medicaid case filing for the kids so that I believe the emergency room would be covered eventually. But again, that's not going to help you when you don't have the money for the medicine. You don't have a script. Like, you might have a script, but you don't know how to get a hold of this medicine. And so that's what happened in that case. Another time they had it was I'm going to say undocumented. It was a migrant worker. He had lethal cancer. He's probably gone off and passed on by now because it was all over him. And everywhere he went to, all the free places were like, hey, listen, you're at a point where you need to really take hospice and, finish the ending. So this undocumented, I don't want to call him that, this migrant worker went to the particular free clinic in Florida, an area of Florida. And the next time I saw him was a few months later. He actually had incisions on his face and his chest. You could see they removed an extensive amount of cancer from him. So he was there, as far as I knew before. I had to transfer over to a more military area, like Norfolk area, with my spouse at the time I was out. So these free clinics do work, and they do great work. I've also seen them help another person where they needed long-term immunosuppressor treatment help, and they just didn't have the insurance for it, but they weren't sick enough, disabled enough to get help from federal government. They didn't have children for the Medicaid. So these free clinics are great. So definitely support your local free clinic if you know where there is one. Speak about them to people that don't have health insurance. Good luck. Keep fighting the good fight. It's not easy. Leave your questions, comments, concerns in the comments.